Stop scrolling. If you're prepping for the CNA exam, this chapter on mental health and social needs is essential. We've got 25 practice questions to test your knowledge and boost your confidence. Ready to pass? Let's go.
Question 1. A resident recently moved into the nursing facility and repeatedly says, "I want to go home." What is the best CNA response? A. Ignore the statement so the resident eventually stops saying it. B. Tell me what you miss most about your home. C. You cannot leave because it is against the rules. D. This is your home now. You must get used to it. Correct answer is B. Residents entering long-term care often experience emotional loss and adjustment stress. Asking what they miss encourages conversation and emotional expression. Listening helps reduce anxiety and loneliness. Therapeutic communication supports mental well-being better than dismissing feelings.
Question 2. A resident who usually participates in activities suddenly refuses meals and group events. What should the CNA recognize as the most likely concern? A. The resident is simply tired of activities. B. The resident prefers to stay alone permanently. C. The resident is showing possible signs of depression. D. The resident is being difficult intentionally. Correct answer is C. Withdrawal from activities and appetite changes are common warning signs of depression in older adults. Social isolation can worsen emotional health if ignored. CNAs must observe behavior changes carefully. Reporting these changes allows the nurse to evaluate the resident further. Question 3. A resident becomes angry and shouts at staff after needing help with dressing. What is the CNA's best response? A. Tell the resident that yelling is unacceptable. B. Walk away immediately without responding. C. Tell the resident they must behave better. D. Respond calmly and acknowledge the resident's frustration. Correct answer is D. Loss of independence can cause frustration and anger in residents. A calm tone helps prevent escalation of emotions. Acknowledging feelings shows respect and understanding. Residents often calm down when they feel heard rather than criticized.
Question 4. A CNA is assisting a resident who is embarrassed about needing help with bathing. Which action best protects the resident's dignity? A. Provide privacy and allow the resident to do as much as possible independently. B. Leave the bathroom door open for convenience. C. Finish the bath as quickly as possible without talking. D. Tell the resident everyone needs help sometimes. Correct answer is A. Maintaining dignity is essential for emotional health. Privacy and independence help residents feel respected rather than helpless. Encouraging residents to perform tasks they can still do supports self-esteem. Preserving dignity reduces embarrassment and emotional distress. Question 5. A resident frequently complains about the facility and criticizes the staff. What is the most appropriate CNA response? A. Ignore the complaint completely. B. Argue to prove the resident is wrong. C. Listen to the concern and report it if necessary. D. Tell the resident to stop complaining. Correct answer is C. Complaints may indicate frustration, fear, or unmet needs. Listening respectfully shows the resident their concerns matter. CNAs should not argue or dismiss concerns. Reporting issues helps the healthcare team address possible problems.
Question 6. A resident's family rarely visits, and the resident often sits alone quietly. What action by the CNA best supports the resident's social needs? A. Leave the resident alone to avoid bothering them. B. Move the resident away from others to keep them quiet. C. Tell the resident family visits are not important. D. Encourage participation in group activities. Correct answer is D. Social interaction helps maintain emotional well-being and reduces loneliness. Encouraging activities allows residents to build relationships with others. Isolation can worsen depression and anxiety. Supporting engagement promotes a healthier mental state.
Question 7. A resident says, "I feel useless now that I cannot work anymore." What is the best CNA response? A. You still have value and many important qualities. B. You should not feel that way. C. Everyone gets old eventually. D. You must try to think positively. Correct answer is A. Loss of role and independence can lower self-esteem in older adults. Recognizing their value supports emotional health. Encouragement helps residents feel respected and meaningful. Dismissing their feelings may increase sadness.
Question 8. A resident begins crying while talking about their spouse who recently passed away. What should the CNA do first? A. Change the subject to distract the resident. B. Tell the resident to stop crying. C. Leave immediately to give privacy. D. Offer comfort and allow the resident to express grief. Correct answer is D. Grief is a natural emotional response to loss. Allowing the resident to express sadness helps the healing process. Emotional support and presence can be very comforting. Ignoring or stopping emotional expression can increase distress.
Question 9. A resident refuses to attend social activities but enjoys reading quietly. What is the most appropriate CNA approach? A. Respect the preference while encouraging optional participation. B. Force the resident to attend activities. C. Remove reading materials to encourage interaction. D. Report the resident as socially withdrawn immediately. Correct answer is A. Residents have different personality preferences. Some enjoy quiet activities rather than group events. Respecting choices supports autonomy and dignity. Gentle encouragement without pressure maintains emotional comfort.
Question 10. Which behavior most strongly suggests a resident may be experiencing loneliness? A. Asking for assistance with meals. B. Frequently seeking conversation with staff. C. Sleeping during the afternoon. D. Requesting pain medication. Correct answer is B. Residents who repeatedly seek conversation may be trying to fulfill social interaction needs. Loneliness is common in long-term care settings. Simple communication can significantly improve emotional well-being. Social contact reduces feelings of isolation.
Question 11. A resident says, "No one cares about me here." What is the best CNA response? A. That is not true. B. Ignore the statement. C. Tell me why you feel that way. D. You should not think like that. Correct answer is C. Open-ended questions allow residents to express deeper emotions. This helps staff understand underlying concerns. Feeling heard can reduce emotional distress. Dismissing feelings may worsen sadness. Question 12. A resident who is independent now needs assistance with many tasks and becomes withdrawn. What is the most likely cause of this behavior? A. The resident is bored with daily routines. B. Loss of independence affecting self-esteem. C. The resident dislikes the facility environment. D. The resident is intentionally avoiding staff. The correct answer is B. Dependence on others can strongly affect a person's sense of identity. Many older adults associate independence with personal value. Losing that ability may lead to sadness. Question 13. Which action by a CNA best promotes a resident's sense of independence? A. Completing tasks quickly for the resident. B. Doing everything to prevent mistakes. C. Allowing the resident to perform tasks they are able to do. D. Limiting the resident's participation in care. Correct answer is C. Independence supports dignity, confidence, and mental health. Allowing residents to perform tasks maintains functional ability. Over-assistance may increase feelings of helplessness. Encouragement promotes self-respect. Question 14. A resident becomes upset after hearing loud arguments between staff members in the hallway. What should the CNA recognize? A. Residents are not affected by staff behavior. B. Staff conflict improves workplace honesty. C. The resident should ignore staff conversations. D. Loud arguments may create anxiety and emotional distress for residents. Correct answer is D. Residents often feel vulnerable in care environments. Hearing staff arguments can make them feel unsafe or stressed. Professional behavior contributes to a calm environment. Question 15. A resident repeatedly asks staff to sit and talk for long periods, even during busy times. What is the most appropriate CNA action? A. Sit and talk for the entire shift. B. Tell the resident's staff do not have time. C. Ignore the request completely. D. Briefly interact and encourage other social activities. Correct answer is D. Residents may seek conversation due to loneliness. Brief positive interactions show care while maintaining workflow. Encouraging social activities provides additional interaction opportunities. Balance is necessary to meet both emotional and care needs. Question 16. A resident expresses anger towards staff after being told they need assistance walking. What is the most likely emotional reason? A. Fear of losing independence. B. Lack of understanding about walking. C. Desire to break facility rules. D. Intentional disrespect toward staff. Correct answer is A. Loss of mobility can threaten a resident's sense of independence. This often leads to frustration or anger. Emotional reactions may reflect fear rather than hostility. Understanding this helps staff respond with empathy. Question 17. Which CNA action best supports a resident's emotional well-being during daily care? A. Avoiding eye contact during care. B. Limiting communication to instructions only. C. Speaking respectfully and involving the resident in conversation. D. Completing tasks silently and quickly. Correct answer is C. Communication is essential for emotional support. Respectful conversation helps residents feel valued. Social interaction reduces feelings of isolation. Personal connection improves overall mental well-being.
Question 18. A resident who previously enjoyed hobbies now shows little interest in anything. What should the CNA do? A. Assume the resident's personality changed. B. Ignore the change since it is common. C. Force the resident to participate in activities. D. Report the change to the nurse. Correct answer is D. Loss of interest in activities may indicate depression or emotional distress. Early reporting helps the healthcare team evaluate the situation. Behavioral changes should never be ignored. Timely attention may improve outcomes. Question 19. A resident thanks the CNA repeatedly for small tasks and apologizes often. What might this behavior indicate? A. Strong confidence. B. Fear of being a burden. C. Happiness about care. D. Excitement about attention. Correct answer is B. Residents sometimes worry they are inconveniencing caregivers. This can reflect low self-esteem or anxiety about dependence. Reassurance and respectful care help reduce these feelings. Encouraging dignity improves confidence.
Question 20. Which CNA action most effectively supports a resident experiencing loneliness? A. Limiting interaction to required care tasks. B. Avoiding conversation during busy times. C. Encouraging regular social interaction and activities. D. Moving the resident away from others. Correct answer is C. Social interaction helps maintain emotional stability. Activities provide opportunities for friendship and engagement. Isolation often worsens loneliness and depression. Encouragement supports healthy social connections. Question 21. A resident refuses to talk and appears sad after receiving bad news from family. What is the best CNA response? A. Ignore the emotional reaction. B. Respect the silence while remaining supportive. C. Force the resident to discuss the situation. D. Tell the resident everything will be fine. Correct answer is B. People process difficult news differently. Some prefer quiet time to cope with emotions. Respecting this while remaining available shows compassion. Emotional support does not always require conversation. Question 22. Which factor most strongly contributes to emotional stress when a resident first enters long-term care? A. Learning facility rules. B. Sharing a room with another resident. C. Loss of familiar environment and independence. D. New meal schedules. Correct answer is C. Moving to a care facility often involves leaving home, possessions, and routines. This major life transition can cause anxiety, sadness, and stress. Loss of independence may intensify these feelings. Emotional support during adjustment is essential. Question 23. A resident says, "There is nothing left for me to enjoy anymore." What is the CNA's best response? A. You should try harder to stay positive. B. Tell me more about how you feel. C. That is not true. D. Everyone feels like that sometimes. Correct answer is B. Encouraging the resident to talk provides insight into emotional struggles. Open communication builds trust and understanding. It allows caregivers to identify deeper concerns. Listening is a key supportive skill. Question 24. Which CNA behavior most promotes a resident's dignity? A. Addressing the resident by preferred name and showing respect. B. Talking about the resident with coworkers in the hallway. C. Ignoring resident preferences during care. D. Completing care quickly without explanation. Correct answer is A. Respectful communication reinforces a resident's sense of identity.
Using preferred names shows recognition and personal value. Dignity is essential for emotional health. Respect strengthens trust between residents and caregivers.
Question 25. A resident who rarely speaks suddenly begins talking extensively with a new roommate. What should the CNA conclude? A. The resident should be moved to another room. B. The roommate is influencing behavior negatively. C. The resident is disturbing others. D. Social connection may be improving emotional well-being. Correct answer is D. Positive social relationships can improve mood and mental health. Increased conversation may indicate the resident feels more comfortable. Friendship and companionship are important emotional needs. Supporting healthy relationships benefits residents.
Before you go, drop your score in the comments. How many did you get right out of 25? If you found these mental health scenarios helpful, hit like and subscribe for more real CNA practice. And don't skip the next video. Your exam prep depends on it.